first thing on the agenda is announcements. Desi?
Yeah, just a couple things. As far as Board of Health members, so Pearl Mel Ferguson from Cass County Social Services is no longer in her role. And so they will be hiring and replacing for that. So as soon as that position is filled, they will have that person sit on our Board of Health as well. So not really sure what the time frame looks like on that, but that will be forthcoming. And then Robin Nelson, who probably will be joining us today, but she is the new representative from Fargo Public Schools. So she replaces Dr. Newman for that role.
All right.
Then just as a general announcement, we still have our COVID testing available at the storefront location on 25th Street. So that is Monday through Friday from 8 to 5. We were going to move that back to our building, but given that the numbers are starting to increase a little bit, we decided to keep the storefront for another month. So we would be there through the end of September, and then we will kind of evaluate based on a month-by-month basis. And then walk-in clinics for our COVID vaccine. We are still doing that on Tuesdays from noon to 6. And then people can call for appointments if they would like appointments throughout the other days of the week. That is all I have.
Okay. Thank you, Desi. And I haven't seen another board member join us quite yet. So let's move and wait for the minute approval for later. Let's move to the community needs assessment update from Justin. Justin?
Hello, everybody. So we have completed our every 3-year community health assessment. We do a part of our collaborative with the hospital systems and with public health.
Justin? If somebody, I think, needs to mute, probably. Thank you.
Thanks for that.
Yeah, thank you. We completed our community health assessment as part of our public health collaborative that we have with the hospital systems and with Clay County Public Health. Started in December, I think, when it was originally sent out. There was a part where there's been a lot of change with people in positions and in their different areas. So it was a little different that we've done from previous health assessments. This one, we focused on county health rankings, which from the University of Wisconsin they put out, and it's always a great resource to look at for little snapshots of what's happening. The focus this year really was to use that so we can track more, because previous health assessments we had a much longer survey that got to be a bit laborious for people to go through, and maybe it was even a bit of a disincentive to want to do when it's a couple pages long, which we all know. As far as sampling went, we had, I think it was just under 2,000 responses, which is pretty good. We had stakeholders' responses mixed with community responses. There are identified needs that are, pretty consistent. We see mental health, we see obesity rates, we see, cost of healthcare. Basically, cost of living is usually a concern as well. Finished it in February, and we had our stakeholders event, which was, difficult to plan because we wanted to do like an event in person, but also, providing that option for people to do online. So we had a hybrid event. We had a little over 60 people. And again, one of the challenges coming out of COVID is, finding out who is still around in different positions and where they've moved to, and making sure we have the right contacts. So it was well attended. There was good conversations at our small group tables and online. We have a list of what was discussed and people identified as needs. So the next part of our process is going to be the collaborative kind of discussing what the goals are and finding one goal. We'll have multiple each, but finding one goal that we can then really all work on together. So if say there's an opportunity for a special group that would, the priority group that looks into this, having them collaborate as well with us so we can really make a real community effort rather than singularly working at as individual agencies. And I think that's one of the exciting parts of this time, is we're really trying to focus more on those pieces. That's where we're at right now. I've been on vacation for a week and a half, so I'm a little out of the loop if there's been things. I've been trying to keep up with some emails, but we're going to have to plan another meeting with our collaborative and find out where we really want to put some efforts.
Thank you, Justin. Folks have questions for Justin on the community needs assessment? Okay. Well, keep us updated, Justin. I'm sure you will, on the progress and good work to date. So thank you for that update. And I believe we have one additional person that's joined us. I see Robin just hopped into the, good to see you, Robin. Welcome back to the Board of Health.
Thank you. I still have my handy dandy binder.
Excellent. Perfect. And I do see we had a caller join us as well. Who else joined? All right. Thank you, Dwayne, for joining us. Okay. So we do have, looks like 6 members of the Board of Health. So we did skip over the meeting minute approval piece on the agenda. So I'd like to go back to that if we can. We just got that update on the community needs assessment from Justin. So I will entertain a motion to approve the minutes from May 27th.
This is Arlette. I'll move to approve.
Thank you. Is there a second?
This is Lynn.
I second.
This is Lynn Telford. I'll second.
All right. I heard a fight for the second. Any edits or discussion? Great. If not, all those in favor signify by aye.
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 Right.
All right. Those minutes are approved. And I don't believe I see Jan yet joining us.
She'll be on in about 10 minutes.
Okay, perfect. All right, Desi, then you're up with the Health Equity and Immunization Grant update.
Yeah, so I just wanted to update the group. I know we've had a little bit of discussions with some of you on this project. This again was it's kind of 2 initiatives that are combined into one, which makes it really confusing for us. But so it's health equity and immunizations. And this is a grant that supported by federal funds, but it's coming through the North Dakota Department of Health. The purpose really is to assess equity and access to immunizations. It has a heavy focus on COVID vaccines, but also focuses on all immunizations and increasing rates and health services. We are going to be having a staff position to coordinate these activities and reporting for this grant. We will be putting out, I think we're going to start with an internal process for applicants at first, and then see if there's any interest, and then if not, we would go external. We did initially do a kind of a rapid assessment process for COVID vaccine with a focus group of providers who serve people who may have had, lower vaccine rates or access issues. And the purpose of that group was really to get a sense for what people are hearing as to access or hesitancy issues, and maybe to gain some insight into, ideas and different activities that we could do to increase rates and access. So we did that. We'll also be drafting a health equity strategic plan, or I should say, Justin, that's probably going to fall to him mainly, but and then the person that we hire will also work with him. And we're going to look at how to weave that plan into our programming at the health department and use metrics to meet the metrics of this grant. We're also going to hopefully reach out to the City Director of Diversity, Equity, and Inclusion for assistance and input on our plan. The majority of this funding is to support immunizations, to again increase rates, provide outreach activity, education opportunities, and to improve access. Because of our staffing limitations with public health, we don't have a lot of extra staff given our current pandemic response. So we are going to be partnering with other community agencies to meet metrics of this grant, and we'll be adding new activities as needs present. So this will run for at least 2 years, if not 3. And we've also visited with our public health consultant once about our agency strategic planning. So hopefully we're going to be able to tie that into this as well, and still hoping to do that in early 2022. And we have a tentative contract established with Family Healthcare to help do some of our outreach activities as well for this grant. So more to come. We'll keep you updated on progress and plans, but I just wanted to let you know where we're at right now.
Thank you, Desi. Anybody have any questions for Desi and the Health Equity and Immunization Grant?
Madam Chair, this is Arlette. Desi, were there any conclusions or data from the rapid assessment that you did with the providers initially that kind of came out of the process?
Yeah, Justin, can I put you on the spot to do that since you were there?
Yeah. There's a variety of different things. Again, we go back to our demographic groups, and there's, a lot with younger demographics. They don't necessarily worry so much of the effect from natural infection, so they don't necessarily feel like they have an incentive to get vaccinated. There's been those attitudes. There's also some hesitancy from from religious groups and things. There's ideologies of concern, especially with like the J&J shot. There were some people just want to have a wait and see how other people have done. So there hasn't been like one overarching, this is a big reason. It's really become very much an individualized thing. And there is, with the hesitancy, there's certain people that are just absolute no's. They're adamant about it. There's just not going to happen. So other parts is just finding access. Some people don't necessarily know where to go, and if they have a bit of they're cautious, finding that right time. It's sometimes meeting people where they are. So there's a very long line of different responses from different people and different demographics. So it's a challenge, but we have some ideas that we're working on and things like that. So we'll see what we can do.
Thank you, Justin. Other questions? Okay. So I don't think Jan has joined us yet. So before we jump to Dr. Newman's COVID guidance update, I just want to acknowledge the call to action from the Fargo City Commission on Monday night. And they're looking to us as the Board of Health to make recommendations on next steps. So I listened to the discussion Monday night, and I listened to the discussion at the Fargo School Board on Tuesday, and it is very apparent that this issue on how to handle COVID and the insurgence of the Delta variant is very polarized. So I just want to remind my fellow board members, whether you're an elected official or an appointed public health advocate, I think it is our responsibility to advocate for public health and to make recommendations on issues necessary to maintain the health of the public. And it's not a popularity contest. This is a serious health threat to our community. So whatever recommendations we put forth, just please keep that in mind. So with that, I'll turn it over to Dr. Newman for an update. Thanks.
Thank you, Chelsea. I was asked just to kind of update people on the guidance we've been giving, or I guess reiterating at FargoCast Public Health. It's been changing kind of quickly week to week. So initially on August 3rd, we put out some guidance just echoing what the CDC was now recommending. And the reason for that is because our county had transitioned into a different risk category. We were now considered substantial at that time. So we just tried to reiterate that the CDC has released guidance stressing the importance of COVID-19 vaccination. It addressed new masking guidelines in certain areas, and it provided guidelines for safely returning to schools, all of which we tried to reiterate. So we, because of our new substantial and now we're actually high transmission rate, which we'll get to, residents were recommended to wear masks in indoor public settings. That includes people who are fully vaccinated. And of course, this county designation, risk level is continuously monitored, and it's based on a multitude of factors, primarily new cases, positivity rate, our hospitalizations, our deaths, the social vulnerability index, and then our rate of testing. So we've just been trying to promote, as you said, we presented at City Commission. We were then asked to present at the school board meeting. We've been doing media this week, and we've had press releases and others, but just about really trying to stress that this new Delta variant is the variant of concern. It's thought to be the predominant variant of most cases being sequenced. It was around 1% of cases in May, and now it's estimated to be greater than 90% of the ones that we're sequencing in the US. We know this Delta variant is much more transmissible compared to previous strains of COVID-19, and people carry a substantial amount of higher viral loads, meaning that it's more easily to be transmitted to other people. All of or not all, the majority of our hospitalizations and deaths continue to be among the unvaccinated people. So our message continues to try and stress, if you are eligible for the vaccination, that's something that we would highly recommend. And though it is rare, there are now reports of vaccinated individuals becoming infected and spreading Delta. These are what people are calling breakthrough infections. So the good news, our vaccines are working. These infections are mild, meaning they are preventing severe illness and hospitalizations and death, but it still is allowing Delta to be spread. And then, so we've just been trying to stress that guidance to the community. And then we did send more detailed correspondence to all of the K through 12 schools in Cass County, regarding the specific guidelines for schools. And I'm happy to dive deeper into that if necessary. And then as of August 12th, our county is now designated as having in the high risk category based on our average of new cases and positivity rate and the other things we said. It's now estimated that 90% of US counties are either in this high or substantial designation. So we, again, are just stressing, how contagious Delta is and that people try and take precautions. I think we're really looking to be more proactive this time around than reactive, and just trying to stay ahead of things with the safest guidance that we can. I'm happy to answer any questions or provide more detail if you guys have questions.
We have questions for Dr. Newman.
Madam Chair, this is Arlette.
Go ahead.
So, Dr. Newman, is high the highest status, or is there another level above that?
For the CDC guidance, it ends at high.
Yeah.
High transmission.
Okay, so we are at the highest level right now. Okay.
And I believe that changed yesterday.
Yes, the cases in Cass, I think I didn't look before the meeting, but we were at 242 yesterday, and just as a comparative metric, on July 1st we were at 20 cases, and our amount of testing is down. So,
and I'll just add, one of the things I tried to stress on Monday night at your meeting, Arlette, is I think an interesting trend that we're seeing across the country is the dramatic rise in pediatric cases. And that's something that's been new in this pandemic, but it has just been substantially increasing from week to week. We have pediatric hospitals in the South now that are at capacity and without ICU beds. So it's giving a lot of people pause as we look to return to congregate settings like schools and what this might mean for kids. Hence the very strong K through 12 recommendations that have come out, nationwide.
Well, and not only is it that, but I think we are having a big RSV spike. So on top of COVID, the serious Delta variant, RSV, like we need to do what we can to protect our kids. My 2-year-old has RSV currently, and hand, foot, and mouth, and enterovirus all at the same time. And now I'm like terrified about her also getting COVID on this. It's my last week of maternity leave, so it's been really it's been challenging. But now also my concern is like, okay, I also have a 3-month-old, and when I'm supposed to go back to work Monday, do I send them back to daycare? So this is very serious, and I'm willing to do whatever we can to get people to vaccinate and mask.
Thank you for that, Kayla. I think many pediatric providers across the country share your concern because we are seeing an unseasonality of these viruses that we just didn't see last fall. I mean, it's pretty unheard of to see RSV in July and August, but we definitely are. And that's giving us all a pause as influenza season approaches. There is no data to say how a child will fare doing with the Delta variant and influenza, or the Delta variant and RSV. These are just big unknowns. So again, this push to be proactive and not find out these things the very hard way.
I have a question, Dr. Newman, or maybe Desi. I run the Boys and Girls Clubs, and we are requiring masks for all staff and children. And we have, as a daycare licensed operator, we have not received any guidance from our licensing or public health. We sought it out ourselves. Is there any effort? I'm thinking of my granddaughter, who I'm going to pick up at childcare today. She's 2.5. I know a lot of other licensed providers are not requiring masks. Could that be due to not reaching out to them? And is that, whose responsibility is that?
I can just say briefly, Desi, I'll let you talk too. Our role here is just reiterating the CDC and other medical organizations. So this guidance isn't, we aren't creating this guidance per se. And the guidance that came out was to the community about various things. And then it was only for K through 12 education. So that's a question we've been asked, Robin. It did not address daycares. It did not address college level students. So we are just providing the specifics that we've been told at this time. I would suspect that will change. And of course we will try and convey that to agencies as we're told.
And we have done messaging about that the entire community should be masking within indoor public spaces. There is no mandate or anything associated with that. We're trying to get people just to, recognize that this is serious. I think one of the challenges that we're finding is, last time when we got into the pandemic, and it's like people have to see, they have to be able to physically see that things are going bad around them before they recognize that this is an issue. So because our cases are lower compared to mid-November, and because they're not seeing as much, it's really hard to get people to want to do mitigation strategies when they just are kind of saying, well, it's not going to happen here. It's not as bad as it was. But that's the exact thing that we're trying to prevent. And the problem with this Delta variant is it moves much quicker. And so if you don't get ahead of it, then we are going to see, all of the experts that we've, on our physician call last night, everybody says it's coming. It's just, I don't know if we aren't willing to do some of those strategies, we're going to have a really tough time kind of slowing it down.
This is Liz Telford, and I have a few comments, and then I do have a question. My first comment is I want to thank Dr. Newman for her advocacy and the expertise that she has brought to the conversation, especially in Cass County. And I know it has not been easy, but thank you for continuing to fight the good fight. My other comment is that I believe the local hospitals have almost seen a double in hospitalized COVID patients over the past week, which just really aligns with the risk level that we're at right now. And then I think it's really important for people to understand where Dr. Newman made the point about breakthrough infections, and the reason that we're still asking people who are fully vaccinated to mask is because they can have it, maybe not even know it, their symptoms will be mild, but they can spread it. So that's why vaccinated people in the schools, for example, teachers, will be masked, because a lot of those kids haven't had the opportunity to be vaccinated yet. And then my final thing is a question for Dr. Newman on how do we respond to people who say that masks in a setting like schools is a medical device? Do you have any comments on that?
No, not specifically at this time. I mean, I think that we've received a lot of questions sort of in this vein, and you know, I don't know that it's our place as the Board of Health to be responding to things like that. I'm trying not to get into these semantics or the nuance of some of these questions. I think that our message should just be united in what we are focusing on and what's going to help as mitigation strategies to do this. I mean, you know, we are coming down with these guidelines from the Centers of, you know, Disease Control, the American Academy of Pediatrics. They're looking at all the data available on these topics. They are pushing first and foremost the importance of in-person learning, then the importance of vaccine to those who are eligible, and then a completely layered approach to mitigation in schools. Masking is one piece of that. It is being singled out. It is being very much talked about. But again, I mean, schools, you know, I don't have a specific answer of that because I don't even think we need to be at that level. But I don't know if anybody else has comments about that.
No, I appreciate that. I just know that that's one thing I hear. And to your point, not to get into the semantics of things and just continuing to push the recommendations that are recommended by world-renowned experts. So,
yeah, I mean, we recommend bike helmets. You know what I mean? Is that a medical device? I mean, if you really want to get, I don't know where you would draw the line here. Schools are allowed to recommend dress codes or enforce dress codes. Like, it's just we have laws for car seats and seat belts. And I mean, I don't know, are those medical devices? It's just, I hesitate to get in the back and forth of some of these things being brought forward.
I appreciate that. Thank you. Thank you for all that you're doing for the community.
Thank you.
If I could just interject here a little bit, I agree totally that it doesn't help much to get into conversations that are just black hole and you don't get anywhere with them. So I agree with that statement. The other thing I wanted to just say is that on Monday evening, and we were anticipating or looking forward towards what the school board would probably do in the school system. I also think that the city hall is looking for some assistance with determining what policy level is appropriate. We have employees who are starting to express concern and are wanting guidance. And, you know, I think this time around, it seems like it's again, you know, and it happened last time too, where the national companies are leading basically. So we're seeing more and more businesses that are at least requiring from their employees to wear masks. And that's not the only thing, you know, that we would want to talk about as an employer. You know, there's certainly other aspects of the policy that we had in place before. The question I would have of this group and would request of this group is a recommendation to the city commission and perhaps county commission, maybe even the park district, a recommendation about the employees and as an employer, what would be a legitimate and timely approach to mitigating this risk inside the employment setting.
Thank you, Arlette. I think, obviously, certainly there's a lot of businesses that are taking different approaches to this. And as you stated, there's some national companies and some here locally that have put in place, measures, whether it's around vaccines or around masking or a combination of both of those items. And so I think it's a fair ask. I think that the health department, obviously, looking at the city guidance, has laid out a good framework in terms of, if we're in that substantial or high risk category, what are the recommendations to the public, and certainly those public spaces. So I think that's, when you look at the map that the CDC has put out there, it is quite frightening to see all of the red that exists, and it will move here. Obviously we're at the high end, but there's, many counties throughout North Dakota that aren't quite there yet. And I think that, as been stated before, the wait and see approach is kind of, to some extent what happened before. And we certainly can't afford that. And our healthcare providers, I think, are urging us not to wait and see. They don't want to go through what they have had to go through previously. And so if we can do our part in making those recommendations, I think, part of it is taking the press release that the health department had put together last week, I believe, and taking some of those pieces out of there and the CDC recommendations, and encouraging, that type of guidance moving forward. And so as our levels, if we go back to levels that are not of high transmission, then we relax some of those so that we're following that guidance. I also took a look at kind of what we had put forward previously. So last year, when we did put some of the protocols in place as whether it was a masking strategy or what have you, the recommendations at that point, we were looking at 14 rolling day averages, and we had recommended, at least they need to be consistently less than 3%. We're over that right now, and we have been the entire month of August. And then there was a lot of points about vaccinations and vaccinating folks, and we know that we're not at the levels that we need to be. And so I think there's a whole body of expertise that is pointing in the direction of finding, whether we do make recommendations consistent with the vaccination path or the masking path, or just that layered approach that Dr. was talking about. I think we need to lay that out and push that forward with multiple maybe options layered in there with the recommendations. So that was a lot. So let me pause. Other thoughts?
Is Arlette requesting a formal letter to those elected bodies and taxing entities? I'm wondering if that's what she's seeking. And I don't see her on the screen now.
That was my interpretation, is a formal letter outlining our recommendations to at least the city of Fargo and Cass County. I would put the city of West Fargo in there as well.
This is Lynn Telford, and if Arlette dropped off, I'd be happy to make a motion to write the letter for what you just outlined, Chelsea.
I would second that.
Any discussion? Okay, what we have.
I apologize.
Sorry.
For some reason, I got kicked out. So.
Well, Lynn made a motion, and it was seconded to proceed with a letter recommending that the city of Fargo, city of West Fargo, and Cass County take under consideration the recommendations set forth by public health at direction of the CDC as well. And so any further discussion? we'll take a roll call vote then, please, Lori.
Okay. Chelsea,
Yes.
Arlette Preston,
Yes.
Robin Nelson,
Yes.
Kayla Nelson,
Yes.
and Dwayne Brightling.
Yes.
And
All right.
Lynn Telford.
Yes.
I will draft a letter based on today's discussion and make sure that you all receive a copy of that as well. Appreciate the discussion today on this topic. Okay. All right. Desi, do you know?
Chelsea, Jan is on by phone. She couldn't get on by
Okay.
video. She's on by phone.
Okay. Perfect. Well, we can't see Jan, your smiling face, but hopefully we can hear you.
Yeah, can you hear me okay?
I can. All right. Let's
Great.
get a harm reduction update.
Yes, it's been a really interesting time for us in all of our programs. We've seen a considerable jump, I guess, in the number of people that we're serving month to month. And that would be whether it's the syringe service program, withdrawal management, the shelter, street outreach, mobile outreach, everything. I can't necessarily speak to the, I can only guess, I guess, what is contributing to the increase in numbers, but I know that we're extremely busy and hopefully all of that busyness will ultimately result in fewer people in need down the road. But excuse me. So currently the shelter beds are still located downtown temporarily. I was just in another meeting where we talked about the shelter program moving back over to our normal building on First Avenue, hopefully by, I would say, the first week of September. That will change the number of people we're able to serve in that program as well, because we've only been able to serve, around that 15 to 17 mark in our current setting, just because of limitations and having to make space for people with for COVID and quarantine situations. As far as our street outreach, we've really seen a jump in that. Part of that is we're trying to be as focused as we can in the downtown area, where we've seen an increase in activity by people that we've known from different settings or different programs. Our mobile outreach teams are having nearly 1,000 contacts or more on any given month right now, and that means those folks that they're just connecting with to make sure people are okay, just stopping to visit, maintain the relationship. That doesn't include the number of transports or the number of, that doesn't include like calls from the hospitals, for example, when they have somebody who needs to be transported, or calls from local law enforcement. Those numbers are right around the 230 mark per month of number of transports that we're doing on behalf of police, ambulance, hospitals, and so on. For example, in July, we completed 238 transports to various destinations, which might be hospitals, shelters, withdrawal management units on either side of the border, or some of the program, and there were 112 individuals served in that 238. I could pause for a question if anybody has any so far. I have a lot of numbers, so of course I don't want to just overwhelm everybody. But.
Any questions so far for Dan?
Okay,
Go ahead, Jan.
so I can, some of the things that are really notable, I feel, for this time would be the increase in activity we've seen in our syringe service program. We haven't necessarily added any additional hours there, but we've seen 80, in the 80% area increase in the amount of, in the number of services being provided. So for example, we've had an 85% increase in the amount of naloxone that we're distributing, 24% increase in the number of people that we served in the first 6 months of this year. And so that's really quite dramatic when you take a look at overdose reversals, for example. There were 283 reported saves, we call them. Those are those saves reported by the folks that we're serving that have received naloxone or Narcan from our programs. And that's an 86% increase in the number of overdoses being reported, overdose reversals being reported. We've also trained a number of staff in HIV testing, Hep C testing, and so on. So we've really increased the number of people that are getting access to and completing the testing process. I think that that's an important part of our work right now, is really improving access to some of that for people that might not be as comfortable going to a clinic or some other setting. Also, quite a bit of referrals to treatment, referrals to medical situations, and so on. There's, again, quite a bit of information related to each program, because we have all services broken down into everything from, providing food and water to, providing a number of other supplies, such as medical supplies and so on, in all of our programs. The engagement center piece, I think, is where a lot of our energy is going right now. It's where a lot of my energy is going, and that's the intention to have predictable hours at an engagement center where people can be referred to or stop in on their own and meet some of their most immediate needs, such as doing some laundry, taking a shower, having a safe place to lock up their belongings, and then get connected to a variety of different services. We have a lot of excitement in the community about this project, and we have a lot of other organizations interested in being a part of things. So we're really happy about that. We've had a couple of different holdups in terms of having predictable hours for the engagement center. One of those being some of the money that we'll use to try to operate the center during the day, while we also address the need for quarantine and testing and so on. That money didn't come as fast as we thought it would. And then the other piece with that is having some of the shelter in there. There's just various different things, but I believe in the next 30 days, we should see quite a bit of activity and clarity around the engagement center and what it will look like, here in the fall, and what it'll look like 2 years from now. Any questions on any of that?
Any questions for Jan? So Jan indicated predictable hours. So is there certain times of the day that you're struggling to stay open, that you would like to be open, that you're hoping will stabilize here at some point?
Right now, we're able to be there. We have staff there all the time because the shelter is currently located there.
Okay.
And we're working with, even people that aren't staying with us are able to come to the engagement center now during the day, because as long as they're people that we know. We haven't been able to take citywide referrals yet. For example, somebody who would probably use our services and just wanted to be able to drop in, it'll be a little bit easier for us to do that once the shelter is able to get back over to the other setting. So it's just some of the challenges associated with that. It would be really tough for staff to manage engagement center activity with a number of new people, not knowing how many will show up, and also manage some of the shelter activity and also the clinic activity, because they manage the front lobby and the doors where people come in to go to the homeless health clinic as well. So there's not necessarily a time of day. It's other things that I see, getting resolved or figured out in the next 3 weeks or so. And then our hope is that we will be able to be open at least initially at 8 in the morning to 5 or 6. But my hope is that, in the long run, the engagement center will be able to serve people from 8 to 8.
Okay.
right now a lot of the energy is around, additional energy is around all the shelters getting together to talk about what does it look like as we head into, a potentially difficult time again related to COVID and transmission and the need for quarantine, and then also with winter months coming. So there will be quite a bit of planning done in the next 4 weeks, I would say 4 to 6 weeks, related to what we anticipate or as we try to anticipate an increase in need for space in the shelter system. And a lot's changed since last year at this time, so we just have to get together and figure out some logistics.
Okay. Other questions for Jan?
Jan, it's Robin Nelson.
Hi, Robin.
How are you? Is staffing affecting you at all, like it is every other business in town?
Yes, it is. We were really challenged with staffing issues prior to COVID, just because it's really difficult work. And I know a lot of facilities that were facilities where people are working with people, especially high-risk populations, were facing that same challenge. Now, of course, since COVID and the demands on the workforce and everything that's affecting everybody, regardless of industry, it's certainly affecting us. We have a couple of informal campaigns happening where our staff are helping us recruit and create posters based on their experience. We actually have a video that'll be produced here in the near future, kind of like a day in the life of an advocate in harm reduction, and that'll be attached to our ads online. So we're trying really hard to come up with some creative ways to attract more applicants. And then, of course, because of some of the emergency solutions grant dollars that are geared toward COVID programs, we are able to hire a number of people to increase our capacity to meet the need. And so trying to find those extra people. We just finished filling all of the positions that we have for our normal programming, and now we're trying to fill positions that will be required to operate the new programming. It's quite a challenge. It takes a lot of time.
Jan, this is Arlette. Oh, sorry.
Go for it, Arlette.
This is. What's the current status right now? If I remember correctly, that building was used for isolation and quarantine during COVID before. Do you know what the status is of the shelters right now in regards to that issue?
Of the shelter system overall?
Yeah.
Yes. So each of the shelters received some level of funding to modify or make the changes necessary to increase their capacity to serve people that need to quarantine or recover from COVID. That's one of the meetings that we're going to be having, just to make sure we're all really staying on track with who's able to do what. So currently, we do have beds and rooms available at the Downtown Engagement Center that are reserved for any referrals that we get for people that are literally homeless and do not have a place to quarantine or isolate or recover. However, people that the rest of the shelter system, they are able to serve the folks that they have been serving that end up with that same need. And then I don't know what we're going to do in terms of having like a centralized referral program or some that we did last year, but right now I think our capacity is okay. We don't have anybody in our isolation or quarantine beds in the engagement center right now, but I have heard some things about the other shelters starting to see a need in their own beds. So once those fill up, then we'll be working with those other shelters to figure out where people go next. I've received a lot of phone calls from various entities around the state asking if we will have those quarantine beds available. And so I do provide people with that info, but I also remind folks that, the best practice is to keep people where they are. So if they're in another facility and they can quarantine there, then that's how it should go. And it's when people just literally do not have a place. So a lot of the people that we see that may live outside or are precariously housed, maybe couch surfing, those are the folks that we are most likely to serve in our facility.
Okay, thank you.
Mm-hmm.
Other questions for Jan? Okay. Jan, is there anything that you need from us at this point in time that you can think of that would be helpful?
No, I feel like, we get the support that we need from public health in the city. I think, we know where to go if we do have requests that come up. Right now, it's just a lot of trying to figure out how to manage, some of the many people in our industry of serving people that are homeless are trying to figure out what to do with some of the money we were able to get and how do we realistically pull off some of the programs we can implement when we know that the staffing shortages are out there. So, anybody that you think could do well in this line of work, you can sure point them to the city website where we have an ad posted.
All right. Thanks,
This is
Jan, for that.
Chelsea, I was just going to add too that we're still waiting on the our Gladys Ray shelter building, that was going through that remodel process, and it seems to be like a never-ending remodel process. We are still waiting for that building to be opened back up. That that will also help some of our space issues when that happens. But and planning has been working with us on that too, trying to talk with the contractors and see where the issues are. But we are not back in that space yet.
Right. That's one of the meetings that I was in before I came on to this call. That's one of the things that we were reviewing is realistically, that I do believe that we should be able to start at least transitioning back to that building in the next 3 weeks.
Excellent. Okay. All right. Desi, do you have any other updates?
I don't, other than I just want to publicly say thanks to all of the people that are helping in this effort. I want to say thanks to my staff. It's really hard when they are feeling they've been overwhelmed for almost 2 years. And then the thought of going into, like full on response again is really daunting. And it's really hard to get people up, so we're really worried about burnout and things like that with our public health staff. And I think that was kind of our plea to the public really for this preventative message. It's, not only for our sake, but for the health systems and for just even people, keeping people safe and public health is about prevention and trying to do things before they happen. And like Tracy said, we're trying to be proactive and not reactive. And so just a big shout out to the supporters and the staff that continue to do this mission, even though they are physically and mentally exhausted.
Thank you, Desi. The work that public health has done throughout this and all of our healthcare providers is greatly appreciated and doesn't go unnoticed. People know what public health is now. And, I think in the ideal state, public health operates in the background and keeps everybody safe. And we're front and center these days. And so I'm hopeful that the discussion today and the recommendations that we'll bring forth can create some movement to help prevent, what we experienced last year. So, okay. All right. Well, we are scheduled to meet again on October 15th. Obviously, with everything going on, I think we may need to meet in September. I think we can maybe wait and see at this point if that's needed. And I'll be in contact with you, Jesse, if we feel like we do need to pull together, or if anybody else feels like we certainly can do that. But otherwise, I'll see you all on October 15th, if not sooner. And as I mentioned, I will be sending a letter for all of you to review, and hopefully we can get those recommendations off to those city leaders so that we can see what kind of progress we can make on this front. So thanks everybody for being here today, and have a great.
This is Dwayne Breitling.
Yes.
The Cass County Commission meets Monday afternoon.
Okay.
Be at least 3 weeks.
Oh, I think we lost Dwayne.
That you're going to be sending out, be hand delivered Monday morning to the Cass County Commission. Either that or it's going to be a 3-week delay before it gets to them.
Okay. I was thinking that we would email it. Does that work? I can also hand deliver it on Monday too.
Yep.
Okay.
Because we have at the end of the meeting, there's always a report on correspondence.
Okay.
And that would be available at that time, I would think.
Okay. All right.
Thank you.
Yes, thank you for bringing that up, Dwayne. Any other?
Dwayne, just from a procedural standpoint, would you expect that letter need action of the Cass County Commission? Because if it needs action, it might need to be added to the agenda in the business section, not under correspondence.
That would be, I think you should address it to Mr. Wilson, the administrator, and he'll make that decision.
Okay.
I mean,
But yes, Robin,
that's who the email should go to, Robert Wilson.
I know with the city of Fargo, our agenda items have to be on the Thursday prior to the Monday. So there may be a little bit of a time lag in there that we can't meet anyway, but we can sure try.
There'll be a time lag before we can actually vote on it or take action on it.
Okay.
Thank you.
Well, I will get that letter drafted and I will get that out. Please make sure to watch your email inboxes to make sure that you're in alignment with what's stated in the letter before it gets sent out to the folks mentioned. All right. Okay. Well, everybody have a great weekend and thank you for the discussion today.